My name is Caitlin Lubon, and I'm a licensed marriage and family therapist with Covenant Family Solutions. September is Suicide Prevention Month. With that in mind, I would like to take some time today to talk about the warning signs for suicide and how knowing where and how to get help can save lives. Suicide is the 10th leading cause of death in the United States, but it is often preventable. First, let's talk about some of the signs and symptoms. If someone is exhibiting some of these symptoms, it could be a sign they are thinking about suicide. This can include talking about wanting to die or kill themselves, or talking about feeling hopeless or empty. They may also talk about feeling like a burden to others, or having shame or guilt, or something they feel that they can't escape from. Other symptoms may include increased risky behavior, such as using drugs and alcohol more often, or taking action that could lead to death, such as driving extremely fast. People thinking about suicide may also exhibit behavioral changes, such as withdrawing from loved ones, acting agitated or anxious, changing their sleeping or eating habits, and giving away important possessions. And finally, they may start saying goodbye to family and friends and putting their affairs in order, such as making a will. If you notice these warning signs in someone you know, or if they apply to you, get help as soon as possible. There are 5 steps you can take to help someone suffering with symptoms of suicide. The first step is to ask, are you thinking of killing yourself? This may seem like a difficult question, and many fear that asking someone this question will put the thoughts of suicide into their minds. But research indicates that asking individuals that are at risk of suicide does not increase the chance of suicide attempts or suicidal thoughts. The second step is to keep them safe. This means removing access to lethal items or places. You can start by asking them if they have a plan and then removing the lethal means in their plan. The third step is to be there. This is as simple as listening to the person to learn what they are thinking and feeling. Step 4 is to help them connect. This could be providing them with the phone number of the National Suicide Prevention Lifeline or the Crisis Text Line. You can also help them connect with their family support system and friends, or a mental health professional or a spiritual advisor. Step 5 is to stay connected. Studies show that the percentage of deaths by suicide decrease when someone follows up with an at-risk individual after a crisis. You might ask yourself if there are factors that can put someone at more risk of suicide. People of all ages, ethnicities, and genders can be at risk. There are many factors that can lead to someone attempting suicide, but people at most risk of share certain characteristics. These include substance abuse, depression, chronic pain, prior suicide attempts, family history of mental health disorders or substance abuse, family history of suicide, past or current physical or sexual abuse, having access to firearms, having recently been released from prison, and being exposed to others' suicidal behavior, whether it be peers, family members, or even celebrities. It is important to know that many people have some of these risk factors but do not attempt suicide. Suicide is not a normal stress reaction. Suicidal actions or thoughts are a sign of extreme distress and should not be ignored or thought of as a bid for attention. There are various treatment options for individuals suffering with suicidal thoughts. One option is safety planning, in which a caregiver helps the at-risk person to develop a plan that lists coping skills, people, and resources that can help in a crisis. The plan may also describe ways to limit access to lethal means such as pills or firearms. Research has also shown that specific therapies can be particularly helpful to someone thinking about suicide. Cognitive behavioral therapy helps people recognize thoughts and patterns and assist them in learning healthier actions to take when suicidal thoughts occur. It has been proven to reduce suicidal behavior in adolescents and adults who have been diagnosed with borderline personality disorder. Another option is dialectical behavioral therapy, which can help someone recognize when their actions or feelings are unhealthy and then teaches them skills to better deal with triggers and stress. Medication may also be beneficial to some individuals at risk for suicide. Patients and their doctors can collaborate to find the best medication as well as appropriate dose. To recap, there are many signs and symptoms that someone could be thinking about suicide, but there are steps you can take to help someone who is at risk or even to help yourself. Care and treatment is available to anyone having suicidal thoughts. If you or someone you know is having thoughts of suicide, please call the National Suicide Prevention Lifeline at 1-800-273-8255. This hotline is available 24 hours a day. You can also text the Crisis Text Line by texting HELLO to 741-741 for free and confidential support around the clock. For support in your community, reach out to a local mental health provider like Covenant Family Solutions for help.